Welcome to Health Connection with Kettering Health Network. My name's Chris Welges. We're here today with Dr. Kelly Cole, an OBGYN with Kettering Physician Network, practicing at Fort Hamilton Hospital. Thanks for being here, first of all.
Thank you, Chris.
As women get older, what are some of the conditions that they see more often and that you get asked about?
One of the most common conditions that they come in with is menorrhagia, or heavy vaginal bleeding. It affects about 10 to 35% of the population, and I get frequent visits for that.
How would a woman know if she's suffering from menorrhagia? How would she know that it's abnormal? Maybe she's thinking, well, maybe this is just how I work.
Frequently, a woman doesn't know that it's abnormal until she comes in and has a discussion with her physician. A lot of times what we see is women complain of what they would consider just heavy periods. But when you ask them, their periods are either coming more frequently, they're lasting longer than 7 days, they're calling in sick from work. And when it starts interfering with their lifestyle, their day-to-day living, that's a problem.
What are some of the causes? What makes this happen?
Some of the common causes of menorrhagia would be things like stress, weight loss, or weight gain. Those usually cause 1 or 2 missed periods or late periods. We're not too worried about those. The more common causes would be intrauterine pathology, such as polyps of the lining of the uterus, fibroids pushing on the lining of the uterus. Endometriosis is very common. A lot of women do know about that. Those are some of the more common causes. And some of the rare causes that do need to be ruled out would be cancer of the lining of the uterus and things like that.
And what kind of treatments do you offer your patients who come in and you diagnose with menorrhagia?
We have a lot of treatments that women don't even know about. Traditionally, they always thought that you had to have a hysterectomy. They don't have time to take off of work and things like that. Sometimes we can do just simple hormones, treat their periods, make them more regular, make them lighter. There are certain medications that are out now that you can take just during your period that are not even hormonally related, that will decrease the amount of blood flow that a woman has. Then you're talking more surgical options. If you have a simple polyp or a fibroid, a lot of times I can go in the operating room, a simple surgical procedure, remove the polyp, remove the fibroid without any incisions, minimal recovery time, you're back at work. Then, of course, there are hysterectomy options, but there are a lot more options today than there used to be. Options where you're back to work in 2 to 4 weeks.
So that's good news. It sounds like there are a lot of ways that women can be treated for menorrhagia that are outpatient options that are very quick. Are there any other of those that are really simple things, really simple fixes?
One of the more common outpatient procedures would be an endometrial ablation. There are several types of ablation procedures, but basically what happens is you go in, you remove the lining of the uterus so it doesn't build up monthly and women don't have the bleeding. A lot of times, 70% of the time even, women won't have menstrual cycles after that, or if they do, they're very light.
And with that, like a lot of the other procedures you were talking about, it's a quick...
It's very quick, very easy. You're in, you're out, you're back to work in 2 days.
Okay, well, thank you so much for joining us today. And of course, for Health Connection, keep watching for more videos. Subscribe to the podcast on iTunes. And of course, visit ketteringphysiciannetwork.org to find out more about physicians within the network like Dr. Kelly Cole. Thanks so much.
Thank you.